Hi, everyone. My name is Dr. Ashely Bieniek-Tobasco, and I'm here today with...
Hi, everyone. My name is Dr. Brenikki, Floyd.
And we're here to talk to you about an introduction to risk communication for community health workers. So as I mentioned, I'm Dr. Ashely Bieniek-Tobasco, and I'm a faculty member in the Division of Environmental and Occupational Health Sciences at the University of Illinois at Chicago. And I primarily do research and work in the risk and climate change communication spaces. Did you want to provide a bit of an introduction, Dr. Floyd?
Sure. So as I mentioned earlier, my name is Dr. Brenikki Floyd. I'm a clinical assistant professor in community health sciences at the UIC School of Public Health. And my research focuses mostly on the applications of health communication and implementation science in adolescent health.
Great. So we created this module to create an introduction to risk communication for people who are doing community health work or who are working in community-based organizations, primarily in response to this pandemic, but also people who will be doing work in the public health spaces or needing to communicate about risk related to their work, or perhaps even volunteer experiences that they're doing working in their community. We're really hoping to just provide a resource about how we can communicate about complex risk-related topics, such as the COVID-19 pandemic that's going on right now. If you have any questions following this training, we invite you to reach out to Dr. Floyd, and her email address is listed here. And you can come back to that as needed to reach out for any questions. And just as a reminder, this module is meant to be a basic introduction to risk and health communication and should not be considered comprehensive. So later on in the presentation, we'll provide you with some additional resources if you would like to learn more. And we also encourage you to do your own investigation. Google is a helpful resource as well on risk communication. But hopefully this training will provide you with a good basic foundation on what risk communication is and why it's important for community health work. So we'll be covering 4 main learning objectives during this presentation. By the end of this module, you will be able to define what risk communication is. You will be able to understand the need for risk communication and why it is that we need something specific to name risk communication and why there are specific ways of doing it. You'll also develop a basic understanding of the evidence underlying risk perception and communication practices. And finally, you'll be able to understand specific strategies and considerations for communicating about health risks. So in the first section, we're going to focus on defining risk communication.
So we're asking the question, what is risk communication? And depending on what industry you're in, people seem to have different ideas of what risk communication is and how it works. And essentially, risk communication is the exchange of real-time information between experts and people who are facing threats to their health, economic, or social well-being. Essentially, the goal of risk communication is not to convince people, but to inform people of any critical information that can be life-saving, can help save themselves or their others. But there are also other benefits to risk communication, such as behavior change and or changing beliefs. What is required for risk communication is a firm understanding of one's perception related to risk, concerns, beliefs, attitudes, knowledge, cultural practices, and multidirectional communication about threats. So a definition from the World Health Organization describes the purpose of it as being able to enable people to make an informed decision to protect themselves and their loved ones. So I just want to reiterate that, risk communication should not be seen as an attempt to convince people, but to empower people. And so the next slide talks about 4 forms of communication. One being information and education. So essentially that is providing people with information about a crisis or potential threat of harm so that they can make an informed decision about how to protect themselves and their loved ones. But other forms of communication can have an impact on, like I mentioned previously, behavior change or taking protective action. So for example, if you are getting information about different types of behaviors to protect yourself. Thinking about the ads that you may have seen around smoking tobacco, for example, and the need for cessation to stop smoking. That's one example. Other forms of risk communication, which we're currently addressing now with the current pandemic, focuses on disaster warnings and emergency information. So that's the provision of information to inform us of a current public health threat, or in this case, a global pandemic. And the fourth form of risk communication is referred to as joint problem solving and conflict resolution. And this form is sort of basically rooted in the origins of risk communication, actually. Once upon a time, risk communication sort of looked like communities being very passive in the way in which pandemics or threats were being handled. They just allowed the government to take care of things. But over time, there became a more engaged society who felt like they had a role, which they do, in the decisions that are made in terms of how we respond to different public health crises. And so this joint problem solving and conflict resolution form of communication refers to the dialogue that exists between society and government and public health officials. And so thinking about risk communication and the ways in which we've sort of started talking about this, we want to make clear that risk communication oftentimes is sort of housed at an organizational level in terms of how organizations are communicating about critical information that will impact the public's health and well-being. But we're also wanting to highlight the interpersonal communication aspects that are a part of risk communication in general. So with risk communication at an organizational level, we're referring to systemic organization that's coordinated. Again, it involves this partnership and planning, like I mentioned before. So typically you'll see like an organization like the CDC or your local health department. There is a team of individuals who get together and they coordinate how are they going to communicate to the public about different public health issues. And part of that process is developing messages that are tailored for different community members, basically what we call audiences. It revolves this two-way communication or multi-way communication that allows the organization to be transparent about what we know and disseminating information. Drawing onto those principles, interpersonal communication tends to focus on communication between two individuals or two or more individuals. But it's very similar to risk communication in the sense of having this two-way communication. So think of a sender and a receiver, right? But it's a process that's iterative, right? So I send a message, you receive it, you send a message, I receive it. But it's also transparent in terms of making sure that you know that you're clearly, relaying a message to the person you're speaking with, and also actively listening. Actively listening is also a really important part of the communication process as well. So we want to spend some time throughout the remainder of our time together talking about risk communication at the interpersonal level, and we will draw onto some principles that are relevant at the organizational level.
So here we're going to talk briefly about some potential outcomes of effective risk communication. And these are outcomes that we hope for. We don't always get them all, but we really hope that effective risk communication leads to trust building within communities and between communities and those organizations who are managing risks. We also hope for increased awareness about the risks so that people are armed with information about what type of risk they're facing and how to protect themselves, and so that they have the knowledge of where to find relevant and evidence-based information to do that. We also hope that people will uptake protective behaviors to protect themselves from a risk. And a lot of risk environments are really complicated socially, so people aren't just faced with something that is going to be a risk to them and they're going to do it. There's also a lot of social factors that play a role in the uptake of behaviors, and that's something that needs to be considered in risk communication as well. And we also hope that effective risk communication decreases the spread and belief in misinformation. And so risk communication should tie in a little bit of all of these things and should be rooted in these things. And hopefully, if we have an effective risk communication campaign, these are the outcomes that we would expect. And as Dr. Floyd was mentioning, risk communication is a process. And here we show a little bit of a pictorial of what this process looks like. And this process remains similar, whether it's happening at the organizational or at the interpersonal level. Each of these components of the process of risk communication are important for having an effective communication and for making sure you're connecting with your audience about the risk that you're trying to communicate about. So we'll just start at this portion of the process here, is that, or actually we'll start over here, know your audience. It's really important to know your audience when you're trying to communicate about anything really, but about risks in particular. And this is something that's often underappreciated in the communication space when we're trying to talk about risk. Different audiences have different values. They have different needs. And if you're not in connection with your audience and you don't have an understanding of the needs of your audience, there's a big chance that you're going to be talking past them or creating campaigns or materials or information that's not useful to them or that may not be accepted by them. And that's going to be a waste of resources and also going to miss out on opportunities to help people protect themselves. The second piece of this process is providing information in a timely manner, considering the source, the message, the channel, and the receiver. And we'll talk a little bit about each of those components a little bit later, but each of these components is really important to consider while you're designing a communication because they each have an impact on how it will be received by the audience and if it will be acted upon. Third, Dr. Floyd mentioned being transparent. This is something that's really important, especially when we're talking about risk, and especially about any uncertainties that are related to the risk that we're talking about. And this is because when we're not transparent, and if there's any feelings from the audience or the people that we're trying to communicate with that we're hiding something or we're not being upfront about something, those create opportunities for mistrust to grow. And once you break trust with people you're trying to communicate with, it's really hard to get that back. And so being transparent about those uncertainties up front, explaining to people why those uncertainties exist, what we're trying to do about those uncertainties, and how things will change as we learn more information in a risk communication environment is really important for building trust. The next step in the process is to show empathy and to remember that whenever we're doing communication with people, we're talking with other humans, they have feelings and emotions that are all part of the process in responding to a public health risk or crisis. And that little bit of empathy that you show to your audience when you listen to them and try to figure out what it is that they need and that you care about the information that you're providing to them and that they have access to can really go a long way with establishing a good rapport with your audience. Listening is an important aspect of showing empathy, but it's also an important aspect of figuring out what your audience needs and really learning about who your audience is and how you're going to create materials for them or campaigns or just to talk with them in general about their concerns. And even though I keep saying your audience, this really applies at the interpersonal level as well. You know, if I'm talking to my mom, for example, about a risk, I might talk about it in a completely different way than if I talk to, you know, if I'm giving a presentation like this about risk to where I don't have a personal relationship with this audience, but I do have a personal relationship with my mom. And I know her values specifically. So whether you're at the interpersonal level or the organizational level, having an understanding of your audience can potentially change the way that you talk to those people. So it's important to have an understanding and know what the values are in either case so that you can have something in common to draw a connection with and formulate relationship with that person or those people to help your communications be more impactful. Now that we've defined risk communication, we're going to move on to talking a little bit about what we know about risk perceptions, or the way that people think and feel about risks, and how that impacts how they respond to risk information. And we'll also briefly touch on some of the key considerations for communications practice.